Right. Okay. One of the questions people ask, and one of the things that's reasonable to ask is, what about gastroesophageal reflux disease? Okay. We also call it GERD, or abbreviated as GERD. Okay. It turns out in the United States, GERD, or gastroesophageal reflux disease, is just exploding. And you know it's increasing because you see the ads for the medicines every night on TV. The purple pill, Nexium, Prevacid, Protonix, all these medicines, Gaviscon, all those are anti-esophagitis medicines. So it's very common in the United States. In my patients who are overweight, almost 2/3 of patients preoperatively are on some medication for GERD. And so the reasonable question that comes up, what does the MGB do for gastroesophageal reflux disease? And the short answer is 85% of GERD patients report after surgery that their GERD goes away. So it's right up there with blood pressure and diabetes as being one of the things we're extremely effective in resolving. And let's see if I can explain why. Gastroesophageal reflux disease is gastric acid refluxing into the esophagus, correct? Because the esophagus is not designed for that vat of acid that's in the stomach. The esophagus lining is not ready to take on that blast of hydrochloric acid that's in your stomach. So that when the valve that separates the esophagus from the stomach opens, acid squirts back up into the esophagus and burns like fire. All right, what is the name of the surgery that you're going to have this morning?
Gastric bypass.
Okay, and I want to focus on the second word. It's a gastric bypass. Oh, and what's the problem that we've been talking about? Gastroesophageal gastric. And we're going to bypass the gastric. Ah, right. I see. So that the majority of the acid-producing stomach is going to be bypassed. On top of that, you know that we cut the vagus nerve when we do the new stomach. Cutting the vagus nerve is an excellent treatment for acid and ulcers. In addition, you may know that we make this new, long, narrow stomach, right? And then we go down to the bottom of the abdomen, we pull up the intestine and hook it to the tip of the new stomach, right? Well, this bowel tends to pull down a little bit and pulls the stomach back into the chest. One of the reasons acid reflux happens is that the valve goes up into the chest and tends to open up. And so pulling it back down helps increase the strength of that lower esophageal sphincter. So for all these reasons, we think that the mini-gastric bypass turns out to be an excellent treatment for gastroesophageal reflux disease. Not perfect, but 85% of patients say their gastroesophageal reflux is relieved by the MGB. Pretty cool. So good question.